Social work practice in hospital. Introduction. In this session, you will learn about how social work is practiced in hospital setting. Some people have to live with chronic diseases, adjust to pain, change habits, diet, quit smoking, exercise, and change employment. In all these, the patient must be a partner in the care of the disease, in the prevention, and in its deterioration. What then is medical social work in hospital setting? What are the roles of social workers in the hospital? Learning outcomes. When you have studied this session, you should be able to define medical social work and state the nature of social work practice in hospitals. Social work practice in hospital setting is called medical social work, and it is the application of method of philosophy of social work in the field of health and medical care. It can also be viewed as a branch of social work that deals with the social, economical, physical, and psychological aspects of patients. Medical social work is practiced in hospitals, clinics, and other healthcare settings that are commonly identified with the practice of medicine. Skidmore et al., 1997. Our emphasis here is that the clientele of medical social work are those patients within the hospital setting who are in need socially, psychologically, and whose functioning is in danger of being impaired because of illness, disease, or disability. Nature of social work practice. Social work practice has its varied nature, and these are in form of screening or case finding, crisis intervention plan, counseling, emergency services, on-call programs, documentation and record keeping, collaboration, group work, bereavement services, discharge planning, post-discharge, follow-up, and outreach services. Screening or case finding. In social work practice, we have learnt that every practice has its process. Therefore, the nature of social work practice in hospitals is starting with screening and case finding. To achieve a good screening, brief interviews are necessary to clarify needs. Pre-admission screening is helpful to identify patients who may encounter discharge problems. It may also accelerate preparation for discharge and reduce length of stay in the hospital. Beckman et al., 1988. Crisis intervention. Crisis intervention simply means social work practiced in emergency critical situations that involve chaos or uproar. Example, suicide cases and road accidents. Social workers employ crisis techniques to help the patients and their families to cope in the face of adversity by supporting hope. Crisis intervention facilitates processing of immediate fears and concerns in response to a devastating diagnosis. Example, cancer, HIV/AIDS. Once the immediate crisis is resolved, the situation stabilizes and the parties involved, that is, the patient and family, become organized. Social work intervention shifts from crisis intervention mode. Psychosocial assessment and intervention plan. Assessment is an important nature of medical social work, and it involves gathering and evaluation of information. This evaluation is referred to as assessment. Psychosocial assessment entails evaluating emotional response to medical event and future plans. This also involves assessment of family patterns of communication, decision-making, role flexibility, and response to members' needs. Brief counseling. You need to know that counseling is a kind of talking cure, and this could be brief or long-term. To respond to the immediate need and establish a basis for future work, hospital social workers maintain careful focus on the problem at hand and with brief counseling. Brief counseling is task-focused and often episodic. This may center on decision-making regarding the following: A. Nursing home care. B. Establishing guardianship. C. Understanding a new physical or cognitive limitation. D. Recognizing a need for ongoing assistance with a major adjustment. Emergency Services On-Call Program. You also need to know that most social work departments in hospitals address problems that arise after normal working hours. These services take the form of on-site emergency coverage and include: A. Helping medical staff with problem solving. B. Obtaining resources. C. Identify patients. D. Locating family members. E. Meeting with family in crisis. Documentation and record keeping. It is of importance that social workers' activities are recorded in patients' medical record. These activities include details of all interactions and interventions carried out with all patients. It is also worthy of note that these records are kept for several purposes. They serve as records for future references in cases of legal proceedings, clarifications, and research. Collaboration. For social workers, collaboration is a corollary of assessment and involves facilitating understanding of the patient and their family, conveying psychosocial aspects and its implications for other health providers so that immediate or follow-up plans are adjusted accordingly. In the collaborative efforts, social workers do the following: A. Coordinate and help to implement team decisions. B. Provide consultation. C. Advise and counsel colleagues based on their knowledge of human behavior, entitlements, policies, and resources. D. Consult with the team for needs and concerns of patients and families. Group work. This is a method of intervention which facilitates peer support for patients and their families faced with illness and disabilities. This group work is a kind of service that relieves stress and resolves crises, Northern, 1990, and also provides a setting for problem solving and facing reality. Group work provides opportunities for socialization and helps decrease isolation in patients who might be at risk. Example, disabled and psychiatric patients. Educationally, focus group provides information about the illness, its treatment resources, and practical advice. Groups have been effective in emergency departments, waiting rooms, and other sites. Skolpa and Galinsky, 1990. Groups have also been used to help identify problems that require more intensive intervention. Ross, 1978. Bereavement services. Social workers offer services for bereaved people, particularly family members, in conjunction with colleagues or volunteers. These bereavement services consist of A. Support groups, B. Educational sessions, C. Memorial services, D. Individual counseling, E. Periodic telephoning, F. Assistance with funeral arrangements. Discharge planning. When a patient is admitted, he or she is bound to be discharged or released from the hospital. Social work activities associated with discharge are assessment, emotional and educational counseling with the patient and his or her family, coordination of services such as home care, procuring of equipment or nutritional supplement, and even negotiating with insurance companies to adjust benefits to the needs of their patients. Social workers obtain funding from the hospital administration for special services and are also noted for referral services which support the patient after discharge. Post-discharge follow-up and outreach services. You will have to know that many patients who are discharged from the hospital are less likely to manage their own care. Hence, there is the need for follow-up, monitoring, and service provision. Follow-up services include telephone calls and sometimes home visits to patients who are considered vulnerable. The medical social workers may develop programs that will be offered to the patient's community. Example: health education in schools to promote understanding of educates and improve management of a child with a specific illness. Example: cancer. Ross, 1989. As part of outreach services, medical social workers may organize summer camp, retreat, recreation or other art programs for children with burns, cancer, or sickle cell anemia to assist with adjustment and emotional growth. Activity. Take a moment to reflect on what you have read so far. Based on your learning experience, note down the definition of medical social work as stated by Skidmore. Feedback. Medical social work is practiced in hospitals, clinics, and other healthcare settings that are commonly identified with the practice of medicine. To understand medical social work, its nature has to be spelled out as represented below. Screening or case finding, crisis intervention plan, counseling, emergency service, on-call programs, documentation and record keeping, collaboration group work, bereavement services, discharge planning, post-discharge, follow-up and outreach services. Study session summary. In this study session, you learned that medical social work is a branch of social work that deals with the social, physical, economical, and psychological aspects of a patient. The nature of medical social work includes a variety of services. Example: brief counseling. End of study session 4. Thanks for listening.